But if you happen to have debris in the wound, before you go any further, now's the time you need to clean it out. This is a little bit painful sometimes. Generally speaking, 90% of the time you don't have to do any cleaning. But if there's a lot of dirt in the abrasion or the cut, or a person fell in stones or asphalt, often you have to do a little cleaning. And the first thing you do is you put on your glasses. The next thing you do is get out a tweezers or a small toothbrush. I know Navy corpsmen use a scrub brush on road rash and wounds, and you got to debride it. You got to clean out anything that's in there. You don't want to seal up or close up this room with foreign particles in it, because then you're going to get an infection. But like I said, 95% of the time, don't worry about this. It's only if you see asphalt and grass and foreign material in there, well, you got to do some cleaning. And the way you do that, again, is just squirt the anti-infection and use your glasses with your tweezer or your toothbrush. You can even use a little bit of gauze like this if a toothbrush is too intense, but you got to get the foreign material out of there. You can even press really hard on the area around the wound, or on the other hand, or the person's earlobe, or something to distract them. Give them some nerve tonic. If you have a third person, have them give them a little neck and shoulder massage, a little release, and do some humming, whatever it takes, but I want to get them distracted if I have to clean it out a little bit. The final thing we do is flush it with more anti-infection, clean the area around it, and start taping and bandaging it up. Okay, now I'm going to demonstrate this on a mango and on a banana so you can see how I do it in action. Well, we've had a couple pretty serious cut and wounds here today in the kitchen. We have Mr. Mango and Mr. Banana have cut themselves pretty good. I thought I would use these to demonstrate to you what it looks like and what it's like when you're treating someone that has a good serious cut. Okay, remember the first thing we do, because we're going to have blood, is put some pressure on it. Put pressure on this cut and hold it there and reassure the person that everything's okay. It's not as bad as it looks. It's not that much blood. It just looks like a lot. Relax. Take a deep breath. It's all fine, keeping the pressure on. And remember, now's the time to give them a good dose of cayenne tincture if it looks like they're going to pass out, or give them a nice dose of the nerve tincture if it looks like they need to relax, if they're having panic or anxiety. Now, what's a good dose? Well, 1 dropper full of the cayenne tincture goes a long, long, long way. With the nerve tincture, go ahead and use 2, 3, 4, or 5 dropperfuls. It's all fine. The next thing you do is once you take the pressure off, you quickly flush the wound with the anti-infection tincture. So basically what I'm going to do is, as much as possible, squirt it right in the cut. Squirt it right in there. And really flood and flush this cut and fill it up. And if it's the banana, same thing. Flush it. If you can get the dropper in near the cut, do it and squirt hard. As you can see, I'm squirting hard and flooding this cut. You can see it bubbling out, flushing it. Flushing these wounds with this tincture. It'll be dropping all over the place and coming out. That's all fine and good. And if necessary, you can apply a little more pressure. You can apply a little pressure if it's still bleeding. But right now, the bleeding's really going to stop and slow down on these wounds. Pretty much come to no bleeding at all. Now, you don't want to rub a lot on the wound. You're just holding pressure. But now the bleeding is stopped. Now we want to take a look at what's going on, and this is another good time that you want the person to sit down, stay down, or lie down, because now we have to examine them. Like I said, if there's a third person around, have them squeeze their other hand or other arm, or give them a little neck shoulder, or even some footwork is great because it takes all the energy out of your head. It's hard to be panicking when someone's giving you some good deep footwork. And now we want to look at this wound. Sometimes we need to take a little bit of a cotton swab and just clean it up a little bit to see what we got. But I don't like messing with the wounds much, okay? People do a lot more cleaning than is really necessary to do. After that, we might have to really take something out of the wound. Like I said, 95% of the times, no. Don't worry about if there's something microscopic in there. Forget about it. Anything microscopic, any germ, any bacteria, any virus, any fungus, any antigen, any pathogen, they're dead now. That anti-infection killed them. It's going to work. So now I'm going to look, and it looks good to me. Close enough. You don't have to be an inspector. You don't have to get a microscope. But if you see something in there, like here, I'm looking at here, I see something. Okay, there's a little stone. I'm going to pull that out. Now, don't go jabbing the tweezers in. If you're going to hurt this person like that, you might as well send them to the emergency room at a hospital where they'll torture them to death by cleaning their wound. And go ahead, and if you see something, get rid of it. Pull it out. Often, if there's wood involved, you get splinters. And if you see a splinter, go in and just pull the splinter out. Once a person's been cut like this, usually the nerve endings have been cut and they don't feel anything. So now you have a little window of time where you can work with them a little bit. And if necessary, while you're in there and you've cleaned it out, flush it again. Flush it again, like that. Flush it again with your anti-infection. See how I'm flushing that out? Flush the wound out. Now we know it's clean. Now, if you have to, on a big wound, sometimes you have to get out the toothbrush, but this is painful. Give them a little more. Maybe before you do this, you've stopped the bleeding. There's no problem with leaving it open a little bit. Go ahead and get a friend that can give them a little massage or do some footwork, because this can hurt. Sometimes on a cut it doesn't hurt, but on road rash or a brush burn, it really hurts. And then just lightly, you might have to clean it just a little bit. But like I said, that's rare. That's 5% of the time. Really, right now, we're ready to close this wound back up. And this is where you can use tape, but you can also use butterfly bandages, which are bandages like this, with a thinner area in the middle. They come in packages like this. You can also use these new, I found them, wound closure strips, which are breathable and good, and they're thin. The thing is Band-Aids aren't good enough here. You need some good adhesive. So if I'm going to close the wound, one of the ways you do it, now at this point you can't be afraid to manhandle the person. You can't be afraid to grab that wound area. Now, if you got a lot of anti-infection around, or there was a lot of blood around, go ahead and take some alcohol on a cotton swab now and clean the area, simply because the bandages won't stick to the anti-infection a lot, and they won't stick if there's a lot of blood there. So go ahead and clean the area around the cut. Don't get the alcohol in it. We already got it clean. You're just cleaning the skin around it, so now the bandages that we put on will adhere. And give it a minute, because that alcohol has to evaporate now. I'm going to even give a little blow on it. So now we got, the bleeding is stopped, the wound is disinfected, and now we just have to put it back together. Now, in a hospital, they would use stitches or staples, but we use glue, which is our anti-infection, and we use tape. Now, one thing I have found, and this has been proven in many medical studies, is if you go in and trim this wound up and cut away flesh, it will not heal as well. But torn skin, just like a piece of splintered wood, when you put it back together like this, it heals much better, it heals much faster, okay? It's just like putting it right back together, like you have a piece of splintered wood. You know how you can put it back together and glue it? Okay, you're putting it back together. It heals better, it heals quicker, and your tendency is you won't have a scar at all. So the worst thing you want to do is trim that out or get aggressive or go to the hospital and have a doctor do that. Just stick it back together. So now we're ready to start taping it back together. And what I like to do is put a little more glue in there, unless you feel like you have plenty of it. But don't get it everywhere now, because now we want to tape. But put some glue in there. Okay, this is my anti-infection glue. Remember, the tree resins are like glue. Then you take one of your butterfly bandages, and this is where you have to be a little aggressive. You have to squeeze the area back together. Put the bandage on one side like this, and then pull it together and put the bandage down. See how it drew that area back together. And then press on the bandage a little bit. And I'm going to do that again. First I put it over here, squeeze the area back together, and put it on. And press it down a little bit. You can see how now that area is closed up really nicely. Now, as you can see already, these strips started peeling away and falling off, and the wound opened up a little bit. No big deal. Remember I said earlier, third time's a charm. Wounds don't always behave like you want them to. So one of the reasons that happened is because the mango skin is a little wet and there's a little anti-infection on it. So if this was a wound, you might have to clean it a little more. But I'm going to go to one of these bigger strips now so I can really get some adhering. Again, now you push the wound together and get the strip on like this. This is working much better. You can see how that closed up really nicely. And do the same again down here. But remember, right before you tape it, you got to push that wound together and then tape it down. Now at this point, I always do something else, because see how that's drawn together really tightly? But I like to do a little more, because often the last thing I want to happen is this to loosen up. Now again, these are breathable wound closure strips, but you could have done this with duct tape, electrical tape, but there's nothing wrong with getting some good supplies out of the pharmacy. But now what I want to do is back up the strength of these strips with some additional tape. Okay, because I don't want those pulling loose. So I want to tape them down. And once they're taped down good, well, that's almost all you need to do. If you feel that you want to cover it, you can. But I like to let wounds breathe if they need to weep and if they need to get air circulation. So this person shouldn't be going anywhere right now. If they have a split this long or a cut this long in their leg or their knee or their arm, they shouldn't be doing anything. Even if this cut's only a quarter of an inch long in their finger, now the day's done. No matter what time it is, it's time to go watch a DVD, relax, listen to some music, do some meditation, whatever. But work's done for a day or two now. We got to let this heal. I'm going to show you the same thing. I'm going to repeat it here with the banana. Now with the banana, it's possible that our strips are going to work, our butterfly bandages. But again, we got to put it together. And when you push it together, well, some anti-infection might come out, and some extra blood might come out. But we need to get it together. Now's the time. And I used a banana because bananas are harder. They're a little more like the body to get together. Now, I'm not happy with that. And, you know, you might have to move the person around. And you can see with this, we got banana coming out. Now, sometimes with a deep cut, you actually get fat and tissue coming out of the wound, unidentifiable material. That's okay. So you can clean that up a little bit. And I'm going to use one of my bigger strips here because I can see that I need some industrial strength closing. So I'm going to put that on and see it already messed up. And you know what? That's the second time I don't like it. But remember I said third time's a charm. Bandaging the body is not the easiest thing to do in the world, so don't worry about doing it 2, 3, 4 times. Don't stop till you feel good about it and get it right.